First, check the manufacturer's instructions for the low-profile feeding tube. Identify the type and amount of water you need to fill the feeding tube balloon. Make sure your patient has an empty stomach if possible. Then, clean your hands with soap and water or alcohol-based hand gel. Clean your work surface with soap and water or a disinfecting wipe. Cover your work surface with a clean cloth or towel. Assemble the supplies you need for the feeding tube change: non-sterile gloves, clean container with the type of water recommended for flushing the tube, a luer tip syringe, a clean container such as a measuring cup with the manufacturer recommended type of water for filling the balloon, an empty end-fit syringe, pH strips, a stethoscope, a low-profile feeding tube kit which contains the proper size and length of tube, water-based lubricant, a gauze pad, a small basin for warm soapy water, a washcloth, and small towel. Put on the non-sterile gloves. Next, remove one pH strip and place it on the work surface. Remove the paper cover on the feeding tube kit. You can use the kit tray to hold your supplies as you prepare to insert the tube. Fill the luer tip syringe with the recommended type and amount of water. Set the syringe on the work surface. Check to make sure the low-profile feeding tube does not appear damaged. If the feeding tube kit comes with a stylet, guide it into the tube. Attach the filled syringe to the balloon valve, which is labeled BAL. Slowly inject the water into the balloon. Check to make sure the filled balloon has an evenly rounded shape. Check the balloon for leaks. If the balloon is uneven or leaks, contact your medical equipment supplier or follow your patient's plan of care. Pull back on the syringe plunger until all of the water is out of the balloon. Remove the syringe. Set the filled syringe on the work surface. Roll the tip of the feeding tube in the water-soluble lubricant. Set the tube on the work surface. Assist your patient into a comfortable position before starting the procedure to replace the feeding tube. Remove all tape, gauze, and bandages from around the patient's feeding tube. Hold the feeding tube in place with one hand. Connect the empty luer tip syringe to the balloon valve with the other hand. Pull back on the syringe plunger until no more water comes out of the balloon. Gently pull the feeding tube to remove it from the stomach and set it on the towel. Cover the stoma with a gauze pad to absorb stomach contents. Gently guide the new feeding tube into the stoma. Continue inserting until the flat portion of the feeding tube lies against the skin. If you used a stylet, hold the tube in place as you withdraw the stylet from the tube. Hold the feeding tube in place as you connect the water-filled syringe to the balloon valve. Slowly press the plunger to push all of the water into the balloon. Maintain pressure on the syringe plunger as you remove the syringe. Doing this prevents water from moving back into the syringe as you disconnect it. Position the balloon against the inside stomach wall by pulling the feeding tube up very gently until you feel resistance. Use the gauze from the kit to wipe away fluid or lubricant on the feeding tube or skin. Next, check to make sure the feeding tube is in the stomach. Insert an extension into the feeding port of the tube and turn the extension to the right. Pull down on the plunger of the empty syringe to pull air into the syringe. Pull 3 to 5 milliliters of air into the syringe for older children and adults. For infants and toddlers, use 1 to 3 milliliters of air. Connect the syringe to the extension. Open the clamp on the extension. Put the listening end of the stethoscope over the patient's stomach. Then quickly push on the syringe plunger to push air into the feeding tube. Listen for a pop or swoosh sound as air enters the stomach. If you do not hear air entering the stomach, follow the care plan for tube replacement. Pull back on the syringe to remove a small amount of stomach contents. You only need a few drops. Close the clamp on the extension set and disconnect the syringe. Gently push on the syringe plunger to apply a drop of stomach contents onto the pH strip. Set the syringe on the towel. Immediately compare the color of the pH strip to the color chart provided with the strips. The pH should be 5 or lower. If the pH is higher than 5, follow the plan of care for tube replacement. Draw up the prescribed amount of water to flush the feeding tube. Connect the syringe to the extension. Unclamp the extension. Push the plunger to rinse stomach contents from the tubing. Close the clamp, remove the syringe, and replace the cap on the extension. Fill a container with warm, soapy water. Wet a washcloth in the water. Wash and dry the area around the feeding tube site. Apply any prescribed lotions, tape, gauze, or bandages. You may now begin using the low-profile feeding tube to deliver liquid food, water, or medicine.